Hey, Dr. Weinfeld, can you tell me about rhinoplasty recovery?
Yes, of course. Okay, so following a rhinoplasty, you'll go home the same day. You'll have a metallic splint or cast on the outside of your nose, protecting it, helping decrease the swelling. Soft plastic tube-like supports on the inside of your nose. Both of those things get removed at a week. Many patients return to work between a week and 2 weeks. There's still some bruising and swelling at about a week to 2 week time frame. So in terms of social interactions, you can guide how you go about planning your week after surgery, knowing that there'll be a little bit of bruising and swelling. Strenuous physical exercise, you can return at a 2 to 3 week time frame. And then contact sports, I like to have patients stay away from for a 2-month period of time.
Hey, Dr. Weinfeld, can you tell me about swelling after a rhinoplasty?
Of course, any rhinoplasty is going to have swelling, and we do some really important things to help decrease rhinoplasty swelling. In particular, intraoperatively, we give patients a small dose of steroids that helps decrease it. We often use the piezoatome, which is a precise ultrasonic bone cutting device that creates less collateral damage. Furthermore, we also give patients nausea medications if we can keep them from vomiting. They don't have as much swelling or bruising. And then following surgery, we give patients a low-dose steroid course, and then we also give them a very mild diuretic in most cases, which helps further decrease swelling. Even with that effort, though, however, we will see that there'll be some swelling. That swelling really is at its peak at about a week. Furthermore, we know that at about 3-month time frame, 60% of the swelling has gone away, and that remainder, that 40% remainder of swelling, takes a period of a full year to go away. But the results can be immediate. You can see the changes immediately, and even with swelling in place, almost all patients see the really positive results that they're looking for almost immediately when the splint comes off.
What are some common procedures that you combine with a rhinoplasty?
That is a very good question. Okay, so when we're doing a rhinoplasty, we definitely want to make an attractive nose, but we have to think about the face as the platform for that nose, as the frame for that nose. So let's talk about the other procedures that we do to enhance the results of the rhinoplasty, to create better facial balance. The chin is a high impact area. Sometimes people have a chin that looks too big, sometimes one that looks too small. If someone has a chin that looks too big, we can make some very precise bone cuts, bring that bone back, make it look smaller, or even just use a burr to precisely remove some bone. If they have a chin that is too small, that can make the nose look too large, out of balance. One of the ways to make the rhinoplasty result even better by creating balance is to bring that chin out. We can do that with a chin implant, and I like porous polyethylene implants, not silicone implants. And then also we can make bone cuts, an osteoplastic genioplasty with osteotomies. Osteotomies means making a precise bone cut, and we can bring that chin bone down and forwards, and we can use a metallic plate in order to keep it in place to create a better balance between the chin and the nose. 2 other procedures come to mind. One is fat grafting. Sometimes people have very shallow tissue in their cheekbones, perhaps a narrow jaw, even some contour irregularities in the forehead. We can use fat grafting in order to create balance in that way. Fat grafting can add a little bit of volume. We do gentle liposuction in other parts of the body, and we transfer the fat in a very precise way to places on the face that would benefit from some extra natural volume. And then here is one other procedure that can be very beneficial, and that is cheek implants. Sometimes people have very shallow cheeks. Cheeks that fat grafting alone are not going to supplement and create the contours needed, the projection needed to balance with a nose that has undergone a rhinoplasty. And when that's the case, a cheek implant, again, a porous polyethylene cheek implant, can be very helpful. Now, I forgot one procedure. Really, it's kind of 2 procedures, but actually very frequently patients are seeking blepharoplasty. So that can be an upper eyelid lift, lower eyelid, fat pad, extra bag, extra skin treatment, and even brow lifts in order to complement their rhinoplasty. So in reality, there are a lot of procedures on the face you can do to create an enhanced appearance through balance and improvement in a global, comprehensive way.
Weinfeld, how much does a rhinoplasty cost?
Oh, one of my least favorite questions. No, I'm kidding. We are very transparent with pricing. When you call to make a consultation, even without seeing you, we can give you some basic information about pricing so that you will know if the services we provide are within your budget. We certainly don't want you to come in only to find that the surgery is out of reach for you. But the reason that I think sometimes these questions can be problematic is because it makes the emphasis on money instead of value. You know, value is having a surgeon who has experience. Value is having a surgeon who's going to stick with you through the thick and thin. Value is also knowing that you're working with someone you can get along with and that you trust. So money, of course, is important, and you're going to be spending money to get a quality result. But at the same time, I just want to urge people to make sure that they're focusing on all of the important variables when they're making a decision to have a rhinoplasty.